This is Dr. Bryan Kelly. I'm the surgeon-in-chief at the Hospital for Special Surgery, head team doctor and medical director for the New York Rangers. You're listening to Interview with the Surgeon Agent.
On this episode of Interview with the Surgeon, we welcome Dr. Bryan Kelly, Surgeon-in-Chief and Medical Director at Hospital for Specialty Surgery and Professor of Orthopedic Surgery at New York Presbyterian's Weill Cornell Medical College. He cares for several sports teams, serving as head team physician for the New York Rangers, head orthopedic consultant for the UFC, an assistant team physician for the New York Giants and the New York Red Bulls MLS team, as well as a team consultant for hip injuries for several collegiate teams in the tri-state region. Dr. Kelly is Chief Emeritus of the Sports Medicine Institute and served as co-director for the Center for Hip Preservation. He has authored over 140 scientific publications, chapters, review articles, and books.
Hello, everyone, and thank you for joining Interview with the Surgeon. Today, we welcome Dr. Bryan Kelly, Surgeon-Chief for Hospital for Special Surgery. Doc, how are we doing today?
I'm doing great. How are you doing?
Doing good. Thanks for being with us. So let's just jump right into it. What were your goals and aspirations during your residency, and how did those change during your fellowship?
So when I went into my orthopedic residency here at the Hospital for Special Surgery, I pretty much came here knowing I wanted to go into sports medicine. The sports medicine program here at HSS, much of what has happened over the last 40 years in sports medicine started here, and it was sort of the epicenter of sports medicine from my perspective. We got an incredible exposure to it throughout the residency, and then I ultimately went on and did a 2-year fellowship in sports, and then a 3rd-year fellowship in specializing in hip sports injuries with Mark Philippon at the time was at UPMC in Pittsburgh. So I came in pretty much thinking I want to be a sports medicine doctor. I want to take care of teams. And a lot of what I did throughout the residency and fellowship was really focused on that. And the things that I did really were trying to help me move into that direction.
So taking us through that fellowship year, what was your mentality heading into your first job search? And how that perspective changed in the beginning years of your career?
So I was a sports medicine fellow here at HSS, where we focused on general sports medicine. Much of what we were doing, I finished that fellowship in 2001, was focused on shoulder injuries and knee injuries. And my mentor here, Russ Warren, who was the head team doctor for the New York Giants at the time, offered me a job here between my first and second years of fellowship. And it was a sort of a dream come true that I would be starting out at such a great institution and being able to participate in the care of athletes at a professional level. But what I told him was, I said, well, I don't think I'm ready to come back yet. I want to do a little bit of extra training so that when I come back here, I can bring something new to the table, something that really hadn't been developed. And that at the time, it was the field of hip injuries in athletes, and really all athletic injuries were at the time was really focused on shoulder, knee, and elbow, and there wasn't really much understanding of what types of injuries could occur in the athlete that could affect their careers and their plays when it came to the hip. So I decided that I was going to do an extra year of training focusing on hip. And my goal, and that was a big change. I mean, I really believed that from the time that I started that I was going to be a shoulder surgeon or a knee surgeon doing ACLs and instability. There were at the time, there were 22 sports surgeons here, and I couldn't imagine being the 23rd sports surgeon doing the same exact thing that everybody else was doing. So that was a big pivot. I had no real interest in hip arthroscopy or hip injuries. I didn't really even know about it. There were basically 3 diagnoses that I knew about the hip. It was hip arthritis, hip fracture, and hip flexor strain. And so the recognition that there are lots of other types of intra-articular cartilage, labrum, muscular injuries that can occur that can have a huge impact on the future of an athlete, and that there's actually something you could do about it was very interesting to me. So that was the reasoning for spending the extra year doing the hip sports. And then when I came back here, that really changed the trajectory of my life considerably. When I started, I did comprehensive sports medicine, but there was very little hip arthroscopy and hip sports going on here. So my practice quickly developed into a primarily hip injury practice. And about 7 or 8 years into practice, I became exclusively a non-arthritic hip surgeon focusing on hip injuries in athletes. Which was something, if you'd asked me when I was in my fellowship, I would have told you no interest. I'm a shoulder surgeon. I'm a knee surgeon.
So throughout your career, did you ever consider going private practice, or are you academic focused all the way?
I mean, HSS is a fairly unique place. We're affiliated with Weill Cornell Medical Center, and we all have academic appointments there, and we're a large training facility. We do a lot of research. There's a huge, I think I would say the foundation and the pillars of our institution are really focused on education, academics, teaching, and research, which makes it academic, but we're not a university. And in fact, most of the people here do have a private practice. They're sort of in solo practice. So you're running your practice, but you have the benefits of all of the academic institution, the resources that allow you to do your research and teaching and training. So I never, I think we have the absolute best of all possible worlds, because we can exist in sort of our clinical practice can exist in reality. It is a private practice, but we still are able to participate in all the things that you can get out of being in an academic institution as well. So I would say I would never think about leaving what I have here to just go in solo private practice, although there are some benefits to doing that.
What would you say were some of the keys to your success that shaped your early career as you climbed to the top of your industry?
I mean, I think the biggest, I remember when I was a resident, and somebody who had been a chief resident when I was an intern had become a foot and ankle surgeon. And he came back when I was still a resident, started his practice as HSS, and had immediately had an incredibly successful early start to his career. And I said, well, it's really impressive that you're coming back and you're so young and you're doing so great at this institution. It seems like it's highly competitive, and it's a big challenge. And he said, what he said to me was, I think the important thing is coming back to an institution like this with all the resources, but doing something that not very many other people are doing. And so make yourself unique when you start. Do something so you're not the same as everybody else. Separate yourself from others. And that's what I did with the hip injuries and hip arthroscopy. I really came into an area that was there were very few people doing it at this institution and across the country. And then I spent the first 15 years of my career really dedicated to focusing on honing those skills and making sure that I could be amongst the top people in the country treating these types of athletes. And the other thing that I think is important is if you want to excel in an area of specialty, particularly if it's one where you're participating in defining what the field is, you have to participate in all aspects of it. And that's academics, you have to do research, you have to solve problems that other people haven't solved, and you have to be a thought leader in the field. And if you're focused on making yourself unique, defining where your field is going, the direction it is, and really creating new ways to help people, I think those are things that helped me a lot in my career.
What advice do you have for graduating residents and fellows entering the professional job market for the first time?
Find a mentor, find somebody you can trust, find somebody that can help you through all of the new challenges that you'll experience once you enter into the real world. We have a lot of fellows graduate. We have about 40 fellows a year throughout the different subspecialties. There's usually 8 sports medicine fellows, and we have some hip preservation fellows as well. And I try to talk to them at the end of the year, right before they go off to work. And one of the things I say is you're about to embark on the most challenging 5 years of your life. It's going to be more challenging than anything you experienced in your training. And the reason is because you are the one who's accountable for everything that happens to your patients. And that's a big responsibility to bear. And it's a big transition from going from a protected trainee to somebody who doesn't have anybody else to help you with problems that may come up. And you're accountable for the successes and for the failures. So having a mentor who you can use to bounce ideas off of, and at the beginning, if you don't be afraid to ask for help, don't be afraid to go into the operating room with another surgeon who has more experience if you don't feel quite comfortable with it. I think that particularly in the surgical subspecialties, there's there's this feeling and sentiment that asking for help is a sign of weakness. I would say that asking for help at the beginning and leaning on help and mentorship and the advice from people who have more experience is a sign of intelligence. And it's not smart to try to do things on your own, particularly if you're not quite comfortable with it.
With all these annual conferences being done virtually now, what advice do you have for the graduating class regarding their networking and outreaching process?
Well, I think that, I think every specialty is a little bit different, and you have to find the people that are going to be the biggest supporters of your practice. And, it depends on the community that you're in or the type of specialty that you're in. But I would say that regardless of what community you're in and who the most important people are, make sure you communicate a lot with the people that are supporting you as a clinician. And what does that mean for me? If you have primary care sports doctors that are referring you patients, make sure you reach out to them and get to know them, get them to trust you as an individual, as a person, and as a doctor. It's critical in my field when you're taking care of athletes of all different levels. You have to communicate with the team, the coach, the referring doctor, the agents, the mothers, most of the time, some of the time the fathers, and communication to all of the parties that care about the patient that you're taking under your wing is really critical. And don't let the lack of ability to see people in person be an obstacle to communication. In many ways, the virtual technology makes it easier to communicate. You don't have to go anywhere, you click. But never forget to talk to the people that are supporting you, and make sure that you reach out. And if there's pockets of people that you think are potential sources of referrals for you, reach out to them. Do lectures, do talks. If it's virtual, that's fine. In sports medicine and orthopedics, a huge resource for us is physical therapists. Go out and give lectures to your local therapists and tell them about what you're doing and how you manage certain problems, maybe the same, maybe differently, but just let people get to know you, because they're not going to refer to you unless they get to you. And that to me is the biggest importance of networking. The other area is within the field of, if you're in an academic environment, networking through the academic world is important as well. So don't just live in your own bubble. Go out and talk to other universities, talk to other programs, get to know other doctors. Go to national meetings and interact with other doctors who are doing what you're doing, because they can be a support system for you. They can also be a source of information. They can help you out with challenging cases. And a lot of the times, I have friends across the country, and I'll have somebody call me up and say, one of my friends' mother's son is in New York. Can you see them? Because you're the person that I would trust taking care of this person. So I think networking is critical. Communication is critical. Making sure that you acknowledge the people that are helping your practice is critical. And really identify the key people in your world and in your practice that are really making your practice what it is.
Through your experience dealing with some of the top residents and fellows, what are some of the biggest mistakes you see young surgeons making?
I think I think that there's a baseline of 4 things that a young surgeon needs to control and make sure that they're paying attention to. The first is obviously the clinical practice. You have to take care of your patients. Don't try to do too much. Do everything really carefully. But that's pretty basic. I think everyone comes out knowing they're going to do that. The second is their family, because I think there is a real potential for, particularly early in your career, to be so focused on work, so worried about your patients, so worried about your job and your career that you let your family slide. And a lot of residents and fellows leave with young families, and you can't forget about your family, because they ultimately will be your emotional support system throughout the most challenging times. The third is your own personal, emotional, and physical well-being, and this is a huge problem that we see throughout the medical field with regard to physician wellness, physician burnout, and don't pretend you're bigger than that is, because it's a real problem. It can insidiously affect doctors without them even knowing until it's too late. So recognize that this is a stressful profession that can frequently lead to burnout and lead to emotional stressors that make you a less effective doctor. And the fourth is your financial health. I mean, many people will finish their training and they're in their early to sometimes mid 30s, and the most they've ever made over the course of a year is, when I was doing it, it was $45,000 a year. I think it's a little bit better now, but it's not, you're basically living paycheck to paycheck. And then, overnight you're getting a real paycheck. And I think right at the outset, be smart with your money. There's this concept of the white coat investor. When you start your career, spend the same way that you were spending when you were a resident and a fellow. Don't change your lifestyle. Don't go out and buy a Porsche and a 10,000 square foot house, even if you could afford it, because you all of a sudden have more money. The early years of your career are a time where you can really make a significant difference that will impact your 50s, 60s, and 70s. And if you don't do that, it's hard to catch up later on. So I would say take care of your patients, take care of your family, take care of yourself, and take care of your finances. And the mistakes I've seen is not taking care of any or all of those things.
Can you talk about your involvement with the New York Rangers, the New York Giants, and UFC?
Sure. So the New York Giants was the first team that I was associated with from when I started. And as I mentioned, Russ Warren was the head team doctor at the time. And when I came on, I was one of the assistant docs. I was really brought on to help out with training room coverage, help out with game coverage, and take care of the athletes who had hip injuries, because there weren't other people doing that. I was on the sideline for 12 years, and it was an incredible experience. You travel with a team. You learn a lot about being a sports medicine doctor, which is different than being a sports medicine surgeon. And how do you manage the athletes? How do you manage contracts? How do you deal with agents? How do you deal with careers? It's a whole other level of learning when it comes to sports medicine. I'm now 6 years ago, the Rangers, New York Rangers changed their medical staff, and I was asked to be the head team physician for the Rangers, which was kind of like going from residency to a real job, because being an assistant team doctor with multiple layers that buffer you, where you really you can make a mistake, but you can cover it up, or somebody will help you with it, to being a head team physician, where you are really the one making all the decisions, is a whole different level. And my experience with the Rangers has been amazing. I mean, being in charge of medical decision making and the well-being of the individual players, which will directly impact the success of the team, is an incredible experience. And it's also interesting to see the differences, the differences being a doctor in the NFL versus the NHL. As a result of experiencing those differences, we 4 years ago started a professional team doctors conference, where we got all of the medical and training staffs from all of the regional professional teams across all the four major sports into a single room, and just talked about what does it mean, how do you manage an MCL tear of the knee in a hockey player versus a football player versus a baseball player versus a soccer player versus a hockey player. And it's amazing the nuances and the differences between sports, and my time with the Rangers has been amazing. The UFC was, I'd taken care of a couple of UFC athletes, and about 4 years ago, I think it was 3 or 4 years ago when they finally legalized UFC back in New York, and I think it was around UFC 205 was coming to town. We realized that these athletes, who are really incredible athletes, they don't have team doctors. They don't have people to really take care of them. They do have a really great emergency room doctor, Jeff Davidson, who is essentially the team doctor for all of the athletes. He's an ER doc out in Las Vegas, and he's describes himself as the cage doctor because he sits outside the cage. But he needed to be able to refer people to high quality specialists, and he didn't have a go-to orthopedic group, and so HSS became the official hospital for the UFC, and we support the UFC and support the orthopedic injuries that these athletes can get.
We hope you enjoyed this episode of Interview with the Surgeon. Until next time, stay focused and keep following your dreams.